جاهزين؟ بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على أشرف الأنبياء والمرسلين محمد بن عبد الله. أولا شهر كريم، كل عام وأنتم بخير يا رب، وربنا إن شاء الله يرفع عنا هذا البلاء. وإن شاء الله احنا نستمر الآن في المحاضرات اللي هي ال learning أو التعليم عن بعد. كنا تكلمنا في الماضي على الهارت as a pumping organ، تكلمنا على properties of the heart بشكل عام، وتكلمنا على ال cardiac muscle، وتكلمنا عن properties of the cardiac muscle، وقلنا إنها تختلف اختلافات كثيرة على السكريتال ماسل. وبعدين في الأخير تكلمنا على الكوندكشن سيستم اوف ذا هارت، وأيضا تكلمنا على الستراكشر اللي هي الاس اي نود، اي في نود، and then bundle of His branches left and right of His, and then Purkinje fibers. تكلمنا على properties of the conduction system of the heart اللي هي atomicity, rhythmicity, contractility, conductivity, and so on. Today we're going to talk about the cardiac cycle. First, what's the meaning of the cardiac cycle? The cardiac cycle is a complex of events that actually occur in one heartbeat. بمعنى إنه مجموعة أحداث تحدث في القلب في انقباض، في انبساط وانقباض واحد. فعادة احنا بنقول انه ال cardiac cycle consists of two phases. Phase number one, which we call it cardiac diastole. It means the blood is coming into the heart from outside, and this actually is equal to around 0.55 seconds, whereas the cardiac systole اللي هي الانقباض، إذا الانبساط بياخذ مني تقريبا أكثر من نص ثانية، بينما عملية إخراج الدم من القلب اللي هي cardiac systole it is around 0.30 seconds. إذا cardiac cycle consists of two mainly phases. Phase number one, which is the cardiac diastole, it means the blood is coming from outside to inside the heart, and then cardiac systole, which actually is pumping of the blood from inside the heart to outside the heart everywhere. Okay, so this is the two phases of the cardiac cycle. Now we will talk about these phases in details. First, as we said, احنا قلنا في البداية إنه we have cardiac diastole, which actually around 0.5 seconds. It means around 500 milliseconds. So the first phase of the cardiac cycle is the feeling. It means the blood is coming from outside the heart. For example, if we are looking to the right side of the heart, the blood is coming from superior and inferior vena cava. Superior from upper part of the heart and inferior from the lower part of the heart. And then it will go passively or directly because the valves here, the AV valves, which are tricuspid valves and mitral valves, usually is open, whereas the pulmonary and aortic should be closed. Okay, so the feeling of the blood, or the blood is coming from outside through these veins. From in the left side of the heart, we have the pulmonary veins. So the blood will come from the pulmonary veins after oxygenation, and then it will go directly through the opening mitral valve direct to the left ventricle. So the amount of the blood here in the atrial diastole, which is a part of the cardiac diastole, is around 80%. So the amount of the blood which coming passively بدون أي طاقة، بدون أي شيء, just only moving due to gravity and due to changing in the pressure inside the heart. So this amount of the blood is equal to around 80% of the amount of the blood which actually is coming during the cardiac diastole. So the valves, number two, valves, as we mentioned, mitral should be open, tricuspid should be open, because we need to move the blood from the upper part of the heart to the lower part, which is the ventricles. So the next phase, because we have here only 80% of the blood is going directly to the to the ventricle, but it is not enough to make maximum volume in the ventricle. So what we need, we need extra around 20% of the blood should be pushing down from the atria into the ventricles. So this phase we call it the atrial systole. It means part of the feeling, part of the cardiac cycle, cardiac diastole is number one, atrial diastole. It means blood should only passively is coming from the upper part and lower part of the body into the ventricles. And the second is the contraction by itself of the atria. If you remember the conduction system of the heart, what we said, we have delay of the traveling of cardiac impulse in the AV node around 100 milliseconds. Why? قلنا وقتها reason is to complete the atria its contraction. This delay is necessary to make the atria complete its contraction, which we call it atrial systole. So we have 80% is coming passively and 20% is coming due to the atrial systole. Okay, so if you are looking just to remember the cardiac conductive system of the heart, we're going back now to the previous lecture. So we have here the SA node where we have creation of the action potential inside the heart and then traveling to the right side of the heart, which is the right atria, left atria, covering all, and then we have delay of the cardiac impulse in the AV node for around 100 milliseconds, as we mentioned in the last lecture. So this delay is necessary for the atrial to complete its contraction. Okay, going back. Okay, so back again. Okay, so here during the atrial systole, as we mentioned, where we need 20% of the blood to going down to the ventricles to make the volume of the blood in the ventricles reach the maximum. So as we mentioned, the valve here should be open, which is tricuspid and mitral valve. At the same time, the aortic and pulmonary should be closed. So the ECG changes during this phase, which we call it atrial diastole and systole, is represented as a P wave. P wave. This is the P wave. This is the first part of the ECG. And this P wave should be a positive. It means above the ideal line. So the atrial pressure during the atrial systole should be increased because we have atrial contraction. It means pushing blood down. So the right atrial pressure will increase until 4 to 6 millimeter mercury, whereas in the left side it will be a little bit above 7 to 8 millimeter mercury. At the same time, during the atrial systole, we can identify jugular pulsation. What's the meaning of jugular pulsation? It means here we have the jugular veins. If the patient is lying on our, for example, bed, so during the systole, the atrial systole, we can find pulsation of the external jugular vein actually, and this is like a backflow of the blood to the jugular veins. We can find it during sleeping or lying position in normal patients, but in abnormal patients with heart disease, so finally we can find pulsation even in standing position. Okay, so this is the event. We're going back to the most important things. First, we have P wave during ECG because the ECG events is consist of P wave, Q, R, S, and T. So the first wave is the P wave, which actually represents the depolarization and contraction actually of the atria. We are talking about right atria and left atria. This is number one. Number two, P wave will contract right before the left because we have excitation of the right before the left, but actually practically we have contraction of both ventricles as one unit, and we said in the last time why we have contraction of the right atrium and left atrium as one unit, because it is a striated muscles. Second, it is covered by one specialized layer which actually spread the depolarization from one to the other. So if we have complete depolarization in both right and left atrium, so finally we have contraction of the atria as one unit. The PR segment, which actually starting from the P ending by the Q or R. Sometimes we didn't have a Q in the ECG, so we call it PQ segment or PR interval or PR segment. So that means it is a time which necessary to travel the impulse or the cardiac impulse from the atria or from the SA node into the AV node. This time is very important. It should be less than 0.20 milliseconds. Otherwise, it will be, if it is longer than 0.20 milliseconds, so we are talking about the cardiac block. Cardiac block. It is a kind of cardiac disease and very important. We have to treat it if it's available. And finally, the most important conclusion we can find, that we can auscultate. Actually, it is difficult to auscultate the heart sound. We call it S4 or sound, our heart sound number 4. We should be experienced to hear the sound, which is actually corresponding the movement of the blood during the atrial systole from the atria into the ventricles. So during this movement, so we have to listen carefully by the stethoscope, and we can find a sound, and this sound it is just really experience. Persons can be heard by using the stethoscope. Okay, so what's the outcome again? Movement of the blood from the upper part of the heart to the lower part, 80% passively and 20% actively due to atrial systole. Again, 80% passively due to gravity and movement of the blood inside the blood vessels and negative pressure inside the heart during the time, and 20% only will move actively due to atrial systole. Increase pressure in the ventricles to maximum, and this very important pressure. We call this pressure end diastolic volume. End diastolic volume, it means it's the volume of the pressure in the end of the diastole or in the end of the cardiac diastole. It is equal to 110 to 120, approximately 120 milliliters of blood. Okay. Closure of the AV valves. Why? We said when we talk about the cardiac muscle, the valves actually is working mechanically. So when we have 20% is coming passively blood from the atria into the ventricles, and then we have 20% additional part of the blood is pushing down due to the atrial systole. So finally, during this high pressure inside the atrium and then finally pushing down the blood to the ventricle, so the part of the blood will start going back to the atria. So during this phase or moment, so the AV valve will be closed and we can hear the first heart sound. Whereas when the blood is moving from the atria to the ventricle during the atrial systole, we can hear the sound or the heart sound number 4. But during the closure of the tricuspid and mitral valve, due to the volume of the blood reach the maximum, so in that time we can hear the first heart sound. Okay, this is very important. Second or third or the next one is visualization of the jugular vein pulsation. Visualization of the jugular vein pulsation. We see when the patient is lying in the lying position or in the sleeping position, we can find, just to turn the head to the left or the right side, you can find here in front of the muscle, the most strongest muscle, which is actually sternocleidomastoid muscle, a pulsation. This pulsation, we call it jugular pulsation, jugular vein pulsation, but this is during lying position, maximum to 45 degree. But if the patient is in the disease or pathologically, so we can find this pulsation during standing position. So finally, this is the outcomes of the atrial contraction, and finally we can hear, as we mentioned, the fourth heart sound. بالعربي نقول مرة ثانية، في عندنا عملية ضخ الدم من الأعلى إلى الأسفل، ضخ الدم من الأتريا to the ventricles، هذا هو سميناه الكاردياك دايستل. والكاردياك دايستل consists of passive part and active part. passive part اللي هي 80% of the blood will going directly through the opening AV valves and 20% will go actively as we mentioned. Okay. وبعدين قلنا حجم الدم اللي بيوصل لداخل الفنتريكلز تقريبا 110 إلى 120 مليمتر of the blood during diastole of the heart. Okay. وبعدين قلنا we can visualize the jugular vein pulsation and finally we can auscultate the fourth heart sound. طيب نيجي للفنتريكولار سايستل. خلاص احنا وصلنا للاند دايستوليك فوليوم، الدم انتقل بالكامل الى الفنتريكلز. حجم الدم اللي اصبح في الفنتريكلز قلنا تقريبا 110 الى 120. وبعدين قلنا في نهايه الفنتريكل الاتريال سايستل we have starting flow back of the blood from the ventricle to the atria. So in the time the AV valve will be suddenly closed because it's working actually mechanically. When the blood will start going back, so it will be closed. So no need to use any energy for the closure of the valves. Okay. إذن في هذه اللحظة صار عندنا إيه؟ صار عندنا إنه الدم مليان في الفنتريكلز 110 إلى 120 ملم. AV valve has been closed. Okay. خلي بالكم AV valve has been closed. Aorta and pulmonary also closed. معناه إنه الدم هذا اللي وصل لداخل الفنتريكلز okay during the atrial diastole and systole which is the cardiac diastole by itself. okay. وقلنا 80% زائد 20%. تمام. وبعدين صار في عندنا انغلاق كامل للفالفز. okay. تمام. في هذه الحالة الفالفز كلها مغلقة، الدم موجود داخل الفنتريكلز والدم ماكسيموم والبريشر يفترض انه الان يبدا يرتفع. في هذه اللحظات تبدا عندنا فيز جديده بنسميها ventricular systole which actually is starting by isovolumetric contraction phase. اذا the cardiac systole is consists of many phases. Phase number 1 قلنا isovolumetric contraction phase. What are the major characteristics of the isovolumetric contraction phase? أولا وإذا بنقول iso it means constant, volumetric volume it means volume of the blood in the ventricle is maximum. خلاص ثابت ما فيش فيه أي تغيير. إيش اللي حيتغير في هذه اللحظة؟ اللي هو الكونتراكشن. إذا كيف حيصير كونتراكشن أصلا وليش يصير في كونتراكشن هنتكلم في هذا الفيز. طيب إذا ventricular systole consists of many phases. قلنا أولا isovolumetric contraction phase. في طيب what are the characters of this phase isovolumetric contraction phase اللي قلنا إن الفوليوم أو سميناها ال end diastolic volume is constant. واحد all valves are closed. صح ولا مش صح؟ صح. لوجيك ولا مش لوجيك؟ لوجيك. ليش؟ لأنه الدم محبوس داخل الفنتريكلز الآن. تمام. ومنتظرين نعمل حاجات لكي نخليه يطلع لبرا. بس ايش اللي لازم نعمله؟ اذا يجب ان احبس هذا الدم داخل هذا الفنتريكلز اللي قلنا حجمه تقريبا 110 الى 120 ملم، وبعدين ارفع الضغط داخل هذا الفنتريكلز حتى يكون اعلى من الضغط الموجود فين؟ في البلمونري ارتري وفين؟ وفي الاورتا. ليش ارفعه اعلى منه؟ لكي افتح الفالفز اوف ذا pulmonary and aorta. ما يمكن اصلا نفتحهم الا اذا رفعنا الضغط. كيف ارفع الضغط؟ اذا خلاص اقفل علي الفتحات في كل مكان. قفلنا الاي في فالف، قفلنا السيميلونال فالفز مقفله. اذا ايش اسوي؟ لازم اسوي نوع من انواع الكونتراكشن. لو تذكروا زمان تكلمنا على انواع الكونتراكشن وقلنا في عندنا ايزومتريك كونتراكشن وايزوتونيك كونتراكشن. وقلنا ان الايزوتونيك كونتراكشن اوف ذا muscle ايزوتونيك كونتراكشن معناها انها shortening contraction of the muscle and then we have shortening. اوكي. بينما في isometric contraction we have just contraction of the muscle تمام but no shortening. إذا إيش اللي هيحدث هنا في isovolumetric contraction phase? So the volume is constant but the contraction of the muscle will be increased. This kind of the muscle, this kind of contraction is very very important. ليش؟ هتضل تضغط على الدم تضغط على الدم حتى يوصل البريشر inside the ventricles maximum أو inside the ventricles more than the pressure in the aorta and in the pulmonary artery. In that time what will happen? The valve should be open. Which valve? Semilunar valves. لأنه ما يمكن أصلا ينفتح الأي في valve مرة ثانية لأنه يتغلق ويمنع ال back flow as we mentioned before of the blood back to the atria. إذا هنا السهل حينفتح من اللي هي الأورتال valve. So all valves as we mentioned closed, so the pressure inside the ventricles will start to be increased to maximum in compared to the aortic and pulmonary artery. Specific characteristic is the QRS complex. If you remember the ECG events, so we have P wave and then we have Q down or negative, but then we have R, and then we have S. So this QRS complex is corresponding the depolarization in the ventricles. Okay, and finally, as we mentioned before, we have first heart sound because the closure. And the outcomes of the isovolumetric contraction phase is number one. First, in the first part, we will hear the first heart sound, as we mentioned, LOP, closure of the mitral and tricuspid valve, increase ventricular pressure to maximum. What's the why we need to increase the pressure in the ventricles to the maximum? Why we need it? To make the pressure inside the ventricle more than in the aorta and pulmonary. And what's the outcome? Opening finally of the aorta and pulmonary artery. Okay, so this is the phase as we mentioned it, isovolumetric contraction phase. مرة ثانية نعيد. قلنا في البداية عندنا diastole والdiastole هو عبارة عن atrial diastole plus atrial systole, feeding of the blood to the ventricles. وبعدين قلنا cardiac systole started by the isovolumetric contraction phase معناها انه we reach the blood in the ventricle maximum. So and all the valve had been closed. We hear the first heart sound which is the lap, and then the maximum the heart or the pressure inside the ventricle should be reached maximum. And we said what's the meaning of maximum? It means more than the aorta, the pressure inside the aorta, and more than the pressure inside the pulmonary artery. So the next phase logically should be ejection of the blood, logically. So we call phase number 2 ejection phase or rapid ejection phase. What is the character of the rapid ejection phase? First, semilunar valve should be, which is aorta and pulmonary, should be open. Because why? Because the pressure had been the pressure inside the ventricle due to isovolumetric contraction phase. This is number one. But the mitral valve and tricuspid valve should be open or closed? Should be open or closed? Should be closed, because the blood cannot be back again during the systole or during the ejection back to the atria unless we have insufficiency. It means the valve cannot be closed completely. So the blood during ejection, during the cardiac ejection or during the ventricular ejection or the rapid ejection phase, so part of the blood will going back to the atria. So finally it will lead to hypertrophy of the atria, and this is a disease, not normal. So normally aorta and pulmonary should be open because the pressure had been reached more. So finally part of the blood, around 70%, will be ejected to outside. So this amount is approximately around 70 ml of the blood. احنا قلنا انه الend diastolic volume كان 110 الى 120. اذا during the ejection of the blood, 70% of the blood will going back, around 70 ml. Okay, so what will happen for the last part, around 30 part? This 30 part of the blood will, which actually will stay inside the ventricles, we call it what? End systolic volume. So first volume which we call it end diastolic، وقلنا هو عبارة عن الvolume of the blood in the end of the cardiac diastole. Whereas the end systolic volume is the volume of the blood in the end of the systole after the rapid ejection phase, which is the phase number 2 of the cardiac systole. And this amount is around 30 ml. Of course, logically or clinically, the volume of the blood in the end of the diastole should be beta, should be maximum. تمام. بينما the end of the systolic volume or the volume of the blood in the end of the systole should be beta, to be minimum, because we pumping out the maximum amount of the blood. Okay, this is the logic things. So this is the rapid ejection phase, and what is the corresponding segment in the ECG is the ST segment, and this ST segment starting from the end of S and ending by the first part of the T wave. This segment should be isoline. What's the meaning of isoline? It means not positive, not negative. It means in the isoline, no any changes in the electricity, no any sound we can hear during the ejection or rapid ejection phase, no any sound, because we already listened the first heart sound due to closure of the AV valves, okay, in the end of the atrial systole, and also we heard also the S4 before, okay, pre S4, okay, due to movement of the blood from the atria to the heart. Okay. Now the outcomes: ejection of 70%. Number one, outcome of the rapid ejection phase: 70% of the blood will be ejected to outside, and 30% will be stay there, and we call this volume of the blood in systolic volume, and we said it should be minimum as much as possible, because if it is more than 30%, so we are talking about problems in the cardiac muscle to pump out the blood. creation of the systolic pressure، واللي اتذكرته زمان احنا قلنا من ضمن خصائص القلب انه هو creation of the blood pressure، واحدة من ضمنها during cardiac systole we have a creation of the systolic atrial systolic pressure, which actually normally should be between 100 to 140 millimeter mercury. If it is less, so we are talking about the hypotension. If it is more than 140, so we are talking about hypertension, and we have classification of the hypertension a lot of. Determination of the end diastolic volume, as we mentioned, 110 to 120, and end systolic volume, which actually is around 30% of the blood which actually available in the ventricle during rapid ejection phase. No any heart sounds or no any ECG changes can be recorded during rapid ejection phase. Now we will move now to the slow ejection phase. What's the meaning of slow ejection phase? We said during rapid ejection phase the volume of the blood is maximum in the ventricles and the pressure in the ventricle is reaching to the maximum. What's the meaning of maximum? As we mentioned, قلنا pressure more than the pressure inside the aorta and pulmonary artery. Now what's the outcome? It is necessary for opening of the pulmonary and aortic valve, which is actually the seminal valve. وقلنا الضغط عالي جدا، حيبدأ الدم ينتقل بسرعة كبيرة جدا وسميناها rapid ejection phase. Now slow ejection phase, when the pressure inside the ventricle and aorta and pulmonary artery will be equal, so in the time the blood will start to be going back. When the blood start to going back again to the ventricle, so the semilunar valve will be closed. Why it will be closed? Because also it is working mechanically like what we have during the atrial systole. When we have contraction of the systole, atrial systole, okay, So the blood will be pushing down, as we mentioned, at 20%. But if we have starting blood going back again to the atria, so the AV valve will be closed. The same here, what we have inside the aorta and pulmonary artery. Same mechanism. First ejection, rapid ejection, and then slow ejection when the blood will be equal. So the blood will start going back. During this movement of the blood going back to the ventricle, so the semilunar valve will be closed. So in the time we can hear the second heart sound actually, which is lap top. Okay, lap top. So we can hear the second heart sound. Okay, and then no any ECG changes. T wave actually it is the repolarization actually of the cardiac muscle in the ventricles. So during slow phase we have AV valve open, okay, then the feeling will start again, and then semilunar valve will be closed, so it's the end of the diastole, and no any ECG changes because we are talking about the slow ejection phase, and the heart sounds actually it is the second heart sound which we can hear it normally. Lap, this is the first heart sound. Top is the second heart sound. So the first heart sound is due to closure of the AV valves, and the second heart sound is due to closure of the pulmonary and semilunar valves. Okay. Then we have the last phase is the rapid inflow or rapid venous filling, what we call it, means again diastole, cardiac diastole, movement of the blood passively from the upper part of the heart to the ventricles. So we started by it, and then we now ended the cardiac cycle by the cardiac feeling again. So how we can summarize all this event? We can summarize all this event in one chart, and please keep this chart or keep this slide and copy it and put it everywhere, as we mentioned. Do you remember? We have to put it everywhere. One in blah 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 blah, second in the blah 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 blah, and third should be in the blah 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 blue. Okay, do you remember? Okay, that's good. So what we have here in this slide, number one is the ECG changes during the cardiac cycle. Okay, and we see the cardiac cycle, it means many events occur in one heartbeat. Number one, we have ECG changes, P wave depolarization in the atria, QRS complex depolarization in the ventricles, PQ segment traveling of the impulse from the atria to the ventricles, and we have ST segment starting from the end of S wave ending by the starting of the T wave. This part we call it ST segment, and it is very important because it should be isoline. If it is up or down, so we have problem in the heart. We'll talk about it later on in the ECG. And this is the changes in the pressure inside the different part of the chambers of the heart. Okay, if you are talking about the atrial pressure, it will be increased during the atrial systole, which actually is following by the closure of the semilunar valves. Then pressure in the ventricles, okay, this is the pressure on the ventricles. It will be increased during isovolumetric contraction phase. Isovolumetric contraction phase, okay. And the pressure, the valves here in the end of isovolumetric contraction phase or during the cardiac systole should be open, the pulmonary and aorta. Okay, so finally we have rapid ejection, and then we have slow ejection phase where the pressure is probably equal between the aortic, pulmonary, and ventricles. In the time we can hear the second heart sound. Okay, so this chart is corresponding and expressing all the events of the heart which actually occur during one heartbeat, starting from the atrial diastole, atrial systole, and then ventricular systole. We should start by the isovolumetric contraction phase, then rapid ejection and slow ejection phase. Okay. That's all about the cardiac cycle. طبعا أتمنى لكم إن شاء الله التوفيق. باختصار جدا شديد, cardiac cycle consists of two phases. Phase number one is filling. It means the blood is coming from the superior vena cava and inferior vena cava, going directly through the opening valves to the right ventricle, and then from the left ventricle we have four pulmonary veins. The blood is going also passively. 80% will go direct to the ventricles, and 20% should be due to the atrial systole. Then when we reach the maximum of the blood in the ventricle, which we call it end diastolic volume, which is equal to around 100 to 120 ml of the blood. So finally the valve will be closed and we can hear the second heart sound due to closure of the AV valves. خلصنا. دخلنا في الكاردياك cycle, which is started by isovolumetric contraction phase. وقلنا ان isovolumetric contraction phase معناه انه كل الفالفات مغلقة، الفوليوم ثابت خلاص، بس أنا عاوز tension inside the ventricles to be increased. So contraction, 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 contraction to increase the pressure inside the ventricles to be more than the pressure in the aorta and pulmonary artery. So finally the valves will be open and the blood will go up to the aorta and to the pulmonary artery. Pulmonary artery will go for oxygenation, and from the aorta it will oxygenated blood will go everywhere to the tissue of our body. Okay, so this is the rapid ejection. Slow ejection, it means the pressure inside the aorta and the pulmonary artery will be decreased slowly, and then when the blood will start going back again to the ventricles, the semilunar valves will be closed and we can hear here in the second heart sound. This is the summation of the cardiac cycle. Okay, thank you very much and good luck, and see you again in the next lecture. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.